Welcome back to Angel Winnie Lesson tutorial. In this video, we are going to study about the mental illness. Okay, so last class we have studied about the mental health. In this class, we are going to study about the mental illness. So, what is mental health? As we studied about, it's mentally healthy. He can cope up with the environment, or he can be communicate with others. So that we have studied last class. And here, what is mental illness? So you guys just know what is illness. Illness means any disease or any abnormality. We can call it as a illness. So here illness, the mental illness is a maladjustment in living, and it produces a disharmony in the person's ability to meet human needs comfortably or effectively and functions within the culture. So here some maladjustment in the living. So as you know, what is a maladjustment? It is not able to adjust. That is a maladjustment, and that produces the disharmony, lack of harmony. Lack of harmony means he is not able to agree with anything. He is not able to agree with anybody, and his person ability to meet human needs confidently, so or effectively the function within the culture. Within the culture, he couldn't do the thing, or he can't even cope up with the people, or he can't even comfortably cope up with the, or he can't even do the function effectively within the society. So that we can call it is a mental illness. So that what is that? It's the meaning of mental illness is the maladjustment in the living produces a disharmony in the person's ability to meet needs comfortably and effectively and the function within a culture. So that is the meaning of mental health. So mentally ill person loses his ability to respond according to the expectation he has for himself and the demand that and the society has been for him. So here he is not able to cope up with the society. So what he is, he will forget all the things and he will be doing some other things. So that is the lack of harmony we have seen. So here individual may be considered to be mentally ill if ill. So how we can be considered a person is a mentally ill. Okay, how we can be considered person is a mentally ill. So the person's balance as a behavior is causing distress and suffering to self or others. So he feel distress and suffering to self and others. So mentally ill person means they will very what will we say, the distress. They will be very distressed and they will be suffering something, and themselves from others, seeing others also they will get irritated and they will get too much. You are seeing, have you observed the mentally ill patient? They will be irritated, they don't like the people, means they will very anger if the person comes near to them. So like that. So that is the indication, and the person behavior is causing disturbance is in his day-to-day activities, job, interpersonal relations. So his personal activities. So normal routine activities of ours, we will wake up and we will do our personal things and we will do our works. So in the case of mentally ill person, so he can't even do his daily activities, daily day activities he can't even do. So those people, so we can say is the mentally ill patient. Okay, so that is a mentally ill person. And so now we are going to see about the definition of the mental illness. So mental illness definition we are going to see, that is according to WHO, World Health Organization, says that in 2001 it says that mental illness means mental and behavioral disorders are considered as a clinically significant conditions characterized by alternations in thinking, mood, emotions and behavior associated with the professional distress and impaired functioning. So here he says that And mental and behavioral disorders are considered as a clinically significant conditions. Okay, so that is clinically significant condition as like other diseases. So which is affecting the body, so we used to call it as a diseases. The same like that, mental and behavioral disorder is a considered as a clinically significant condition characterized by, it is characterized by means by alternation in the thinking. The patient thinking, they may have the alternation. He couldn't think, or he will think some other things. He will say, I am in the some other world, I am not in the this one, I am not in the earth, I will be in another planet, something they used to say. So like that, their thinking alternation, and their mood emotional means it may be they will be happy, they may be anger, they may cry. So that is their mood. And the behavior, and this is associated with the personal distress and their impaired functioning. So their mood, their behavior, their attitude will be having altered. So here characterized by the alternate in the thinking, mood and their behavior. So it is associated with the personal distress and the impaired functioning. So that is the definition of the mental illness. Okay, this is a very small and easy definition. It's nothing it is. So it is this behavior and what is that? This mental and behavior disorder is considered as a clinical conditions, as clinical significant. It is characterized by the alternation in the thinking and emotional and the behavior. So which is associated with the person distress and impaired functioning. So that is a very small and easy definition which is given by the WHO. So next we are going to see about the characteristics of the mental illness. Okay, so what are the characteristics of mental illness? So we are going to see. So here it is a changes in one's thinking, memory, perception, feeling and judgment, resulting in changes in the talk and behavior. So what's happening here? So as we said, what is that in the definition it says that it is characterized by the alternation in the thinking and the mood means emotions and the behavior. Same like that here, changes in the one's thinking and memory, perception. So thinking, as you know, so he will be thinking, right? Memory, he will be memorizing. What is the perception? So what he is seeing, he perceiving. So it may be false perception, hallucination. Says that somebody is standing near to me and talking to me. Something it is moving on my head and somebody is going there and talking. Too much noise I am hearing. That's kind of hallucination he may perceive. That's a perception. And feeling and judgment resulting in changes in talk and behavior. Because of these all the things, changes there is thinking, is perception and memory, feeling, judgment. Because of all these changes, what happening? So happening means changes in the talk and behavior. His talk and behavior will be changes. That is a character. Okay, so normal person means, so what others will be asking, okay, we will reply. So in case of this one, like mentally ill patient means they will be very opposite. So what if you are asking something means they will be saying that some other answer, right? So that is the sign of the, or that is the characteristics of the mental illness. Next one is that these changes in behavior and cause distress and resulting to be individual or others and both. Okay, so because of that, what we will feel? Okay, we will feel that, oh, why they are telling like that? I asked one question, he is replying different way, so they will be having problem. They will feel it is distress. So what is that? What is happening? Okay, we will feel something and the person also feels something distress and he will say something, why you are asking like that? They will shout at us. So these are the things both may having. So that is the changes. And changes and consequence distress cause the disturbance in day-to-day activities, work and relationship with important others. So same like that, because of these alternation, what's happening means there because of this changes in the distress and their behavior change, all those things will be happen, and because of that day to day activities may become having the disturbance. It won't be happen smoothly. Okay, so it won't be do the work properly, and the relationship with the important others, it also will be break. Okay, so more, so what we used to do, so we will be communicate, we will talk to parents, and we will do all the works. That is a normal healthy people will do. Mentally healthy people will do. So in case of mental illness people, they won't be have the much communication. If they are talking also in a different way, so it will be having some of the distress, and we will feel something is wrong. Yes, so that is the characteristics of the mental illness. So there are three characteristics. Same only, you can by heart it. Here it is easy to by heart and easy to understand. So next we are going to study about the features of mental illness. So features of mental illness according to classified under the four headings. So there is a four heading. According to that we can classify the features of mental mental illness. So first one is disturbance in bodily functions. What are the bodily functions disturbance will feel after getting the patient may have the mental illness. The mental illness patient, their bodily disturbances, their sleep pattern will be changed, their food habits, their appetite, their bladder, bowel, all the bodily functions, how it will be changed. That we will be studying under the disturbance of bodily functions. What is the disturbance in mental functions? Like their mentally, their mood, attitude, all those things. Okay, so that is the mental functions. And what is the changes in individual and social activities, how they will be cope up with the society, how they will perform, how they will act in the society. So that will be coming under the changes in the individual and social activities. And fourth one, somatic complaints. There they somatic means bodily complaints. They will say, no, I have the problem, doctor, I am not sleep yesterday, sister, I give me sleeping pills, I am not sleep yesterday, and I have some other problem, body pain, ear pain, all the pain they will say. So some of the complaints they will say. So these all are the features of mental illness. Okay, let's study one by one. Here first one is a disturbance in the bodily functions. So first one here, so you have seen, no, sleep. Okay, sleep, appetite and food intake, and third is the bowel and bladder movement, and fourth is the sexual desire and activity. So okay, mainly 4 points will be coming under the bodily functions. First one is a sleep. Sleep, how will be the sleep of mentally ill patient? Okay, so mental patient sleep, how will be, whether they will sleep? No, they won't be sleep. They won't be get the sufficient sleep. They will be very what will we say? They won't be get sleep, and they will be wake up in the night and moving somewhere, going out and screaming. All the things they will show. Okay, so here disturbed sleep throughout the night and no sleep at all. So in the night they will be disturbed, they won't be sleep. So we should take care of the mental ill patient. When you are posted in the psychiatric ward, you should take care of the psychiatric patients. They won't be sleep at night, they will be roaming, they will be doing some other things, they will be hanging, they will do the suicide attempt, all the things. See, they won't get the sleep at all during night. So that is this one features. And the difficulty in falling sleep. Sometimes they say, sister, I'm not getting sleep, what should I do? Give me tablet, sleeping tablet. They used to say like that. So should we give the tablet? No, we should say something else, and we have to make them to sleep. Do not give the sleeping tablet without any reason. Okay, so waking up in the midnight, and they will waking up and they won't be sleep. Again they won't be sleep for this one after mid when they wake up in the midnight. Then individual may experience in some cases. So some cases what happening means individual feel this one shows that lethargy and lack of freshness. What is lethargy? So they will feel very long lasting type this drowsiness. Yes. So when you go for the trip or you are done any night duty something else. Okay. So next day 2 days or else you will be having the night duty 2 days, 2-3 days continuous you have the night duty. How you looks? You will be very drowsy. This one you will be very tired and fatigue, all the things. So that used to call it the lethargy. Okay, patient will be experience lethargy, lack of freshness in the morning. So why they are not sleep at all? So they may have the problem like lethargy and freshness problem in the morning. So that is a sleep. And next one is appetite and food intake. What is appetite? So what is appetite? Suppose a person is don't want to have it or they don't feel hungry. So patient is not feel hungry, so that is to call it is a appetite. And food intake, they won't be take the sufficient food at all. So sometimes increased appetite, they will be having increased appetite. So if you are giving the food to the patient, they won't be having it. So that is increased, sometimes decreased. They won't be have, they will be have it. Okay, the food for a long time. And what is that? If there any appetite means they are not having the food, they are not hungry at all. What happened? Weight loss. Yes. Then sometimes they are having more means weight gain will occur. And nausea, vomiting. So person having the food for, so you guys also, if you are having food for low, so many, or you are having food lot. So what happening? You may feel vomiting and nausea sometimes. So that is the second one. And third one is the bowel and bladder movement. How will be the bowel and bladder movement? Sometimes patient may have the diarrhea, it's not digested properly, so diarrhea may occur, and sometimes they may have the constipation and increased visceration and bedwetting. So the thing which is not digested properly, diarrhea may happen, and which is it's not digested also, constipation also patient may get. And increased maturation. What is the increased maturation? Patient have the profuse urination and bedwetting. During night, it will be wetting the bed. So that is a bedwetting. So that is a bowel and bladder movement. The last one is the sexual desire and activity. So what is a sexual desire? Here it is, the patient may have the interest in the sex. The person may have the interest in lack of interest in sex, and sometimes premature ejaculation will occur. So patient may have the premature ejaculation and impotence. What is impotence? So that is lack of, it's not getting the erectile. Okay, so we can call it, it is a erectile dysfunction. Erectile dysfunction, we can call it is impotence. And lack of sexual satisfaction. The patient won't be have the sexual satisfaction. So that it is the signs of the what is the disturbance we can see in the bodily disturbance. In some cases, the patient may have the excessive sexual desire. The patient may have the more interest to the sex. Okay, so the patient is not, and it is having the or lack of social interactions. The patient is not seeing that not bothered about others. Okay, in the public also, so the patient will show some of the expositionism, so kind of things. Okay, so that it is because of the this one bodily functions. Okay, so these all are the disturbance of the bodily functions. First is sleep, appetite, bladder and bowel movement, and sexual desire. So this is about the disturbance in bodily functions. Okay, so in this video we have studied about the what is mental illness, what are the characteristics, and some of the features of mental illness. So we have studied the disturbance in the bodily functions. So next video I will be talking about disturbance in the mental functions and changes in individual and social activities, somatic compliances. So this is about today video. I hope you guys understand. If you have any doubt, you can comment below the comment box. So I will be continuing the balance class next video. Thank you for listening. Thank you all. Please do share and subscribe and like, and please share to your friends. Those who need my video. Thank you for listening. Thank you all. Bye.